Welcome back to the final part of the program, a program today we've dedicated to COVID watch as COVID-19 cases continue to surge, and now a national crisis, a national health crisis is looming as doctors have vowed that they will not treat patients without that personal protective gear that they so desperately need. The Secretary General of KMPDU, Dr. Chibanzi Mwachonda, still with us for this final part of the program. And I want to now talk about school reopening. Tomorrow, apparently, a stakeholders meeting is being convened by the Education Cabinet Secretary to go full throttle and, ensure that in January, schools reopen across the country unilaterally. Given the circumstances that you have described, is it your view that schools should be open at all?
Schools have had to be opened, and we're not the only country that has opened schools amidst the pandemic. We've seen countries across the globe, in Europe, in Asia, in Africa itself. In fact, in Africa, South Africa was one of the countries that opened up schools, especially for those who were in their final years, and they've had to equip their teachers, make sure that their students are safe in schools. So the decision that was made, and I'd like to say that even as KMPDU, we've been part of the stakeholders in the school reopening. The decision that was made to open schools for the final year students had to be made, and there are no regrets to it, because the reality is that we expected ourselves also that we'll get infections. But the saddest bit is that it wasn't infections, it's been mortalities. The infrastructure needed to have been improved, provision of personal protective equipment to the teachers, and as our sister union, NAT, has said, the elderly, those who have comorbid conditions, should not have been allowed to go back to school to teach. So now teachers are also grappling with the same issues you're grappling with. Yeah, but
even just listening to what you're saying, and I think Kenyans have raised this question even over your if you like, predecessor in your sister union, Wilson Sosyon, talking about it, that it seems like people sat in a boardroom and almost appeared to be taking a gamble with the lives of other people's children by putting them in that situation, knowing full well that that equipment had not been provided, and possibly various other measures would not be followed. And so I still do ask you this, whereas you're saying the rest of the world was putting students in school, here's the reality where even you yourselves are not willing to return to work in 21 days unless you have what you need to treat patients. Should children, our most vulnerable, be back in class?
So at the time that the decision was made, there were certain protocols that had been put in place. Resources were availed to ensure that certain measures are taken. And also, the infections and how the curve was at the time was on a different scale. So schools were opened in October, if I remember correctly, it's October 12th. It's now almost to a month. And the situation has changed, not downwards, but rather it has increased. So that stakeholders meeting that is happening tomorrow still has the opportunity to discuss the whole issues and relook into all that was decided then. So, as we said, it's a stakeholders meeting. Parents will be there through their representatives. Unions will be there through their representatives. The government is the convener. So I'd say we await the decision of the stakeholders tomorrow.
All right, but I'll just ask you, because you're a parent, would you take your kids back to school with the curve on the rise, knowing full well ICUs are full, knowing full well that there are no personal protective equipment even for doctors, leave alone teachers? Would you take your own child back to school?
It's a difficult question, but
that's the decision every parent is asking.
Precisely, but let me say this. Let me say this: that as a parent, through the association, you equally have to assess the school situation. If the school has put in place all the measures and all protocols are followed and everyone's protected, then there's no reason why you should not allow your child to go to school. But if the school lacks the basic minimums that were put as measures and protocols, then there's no point in taking your child into a dangerous zone. I think it's as simple as that. Parents equally are stakeholders, and they can make that decision if they became active to ensure that schools are safe for their own children. It's not an issue of sitting back home and lamenting. You have to take action to ensure that your child is safe.
Right, okay, absolutely. So should the president reinstate then the tough restrictions that there were at the start of the pandemic?
Tough restrictions were quite, were several. I think what was important initially to try and contain the disease was the inter-county movement that had been limited to only essential services. But the disease is now in each and every county. The disease is all over. So even if you are to contain inter-county, you're not going to achieve much. So what perhaps looking at stricter, tougher measures would be to try and limit, one, the super spreader events, be very tough on those, ensure that...
Political events.
Yeah. And ensure that those that require masks are provided with masks. And then the healthcare system now needs resources, not just the workers, even the facilities. The bed space needs to be expanded. We need field hospitals just in case we get to a situation where situation that we saw in March, April in Spain and Italy, where in corridors of hospitals you had patients lined up. I don't want to say that's where we're going, but you need to prepare for all scenarios because the disease is respiratory majorly. It affects your lungs. And it's one of the diseases that is spread in the most interesting manner just by talking to the next person without a mask. So prepare and you know, strengthening the healthcare system now is not just for COVID. It's to realign everything. It will achieve universal health coverage in the long run. It will make sure that Kenya has a public healthcare system that not just resilient, but is efficient to serve the needs of the population.
Right. At the same time, ordinary Kenyans, ordinary citizens and the political class have also displayed a shocking don't care attitude by flouting the already existing protocol. What would you like to say to them? What do you want to say to somebody who's watching this program right now, has been out clubbing beyond hours, doesn't wear a mask, walks around an office space without a mask?
Political leaders determine how the citizens perceive matters. Their opinions shape the public opinion, and I'd say that they've failed us because at the end of the day, after all that, whoever falls sick comes to the healthcare facilities, and we're the ones who now are bearing the greatest burden of all that. So the message is, your healthcare workers are frustrated, tired, and it's time that you took responsibility to protect your healthcare workers so that we are able to get out of this. But if this continues, you'll have no healthcare workers to take care of you because they're dying. They're getting infected. So that's the message. The message is that think of the healthcare worker. If you don't want to think of yourself and you don't care, you're willing to die, don't let the healthcare workers die. This country has one of the least doctor population ratio. 1 doctor to 10,000 Kenyans. So you can imagine the 10 doctors we've lost would have served, how many Kenyans are those? How many Kenyans are those? 100,000 Kenyans, 10 doctors. So that's a gap that will take years to replace. And we cannot afford to go down that route.
Finally, Pfizer say they have a vaccine, and you have heard of the controversial remarks of CS Kagwe in that regard. What is your reaction to that and your expectation of the government in respect of that vaccine?
When you're the leader of a ministry like health and issues around preventive medicine are brought forth, you're better off first deciding on what you will say that will have an impact, because you cannot rubbish without asking for the information, without verifying the information, without ensuring that this is good for the country or bad for the country. If you come out saying that it's not for you, then these people, the Kenyans, the healthcare workers, who might require that vaccine, basically means, because at that position, you determine what happens next in the ministry. And so the government, I know it's part of the alliance, the COVAX alliance, so the government has a responsibility to ensure that we strategically put ourselves in a position to get these vaccines, because I can tell you the rush for vaccines is going to be a rush that will disadvantage the global south. And the global south, I mean the low middle income countries like ours in Africa, Southern Africa, and Asian countries, because we do not have that purchasing power to buy those vaccines, but we can equally pitch to ensure that we get our fair share of vaccines.
Right. I know you may have seen a chuckle from me that may appear inappropriate. It's not to your comment at all, Daktari. I hear you loud and clear, but rather to my crew who are notifying me that I am absolutely out of time. And so I thank you for everything you've said. We certainly do condole once again with the families of healthcare workers who are on the front lines, who've lost their lives. And support doctors. We absolutely do. You're doing a fantastic job. We need you, and we hope that this can be resolved amicably and soon. And so on that note, that we say good night tonight. Thank you for watching Punchline. I'm Ann Kiguta. We'll see you next week. Stay safe. Bye-bye.